Welcome to our podcast, PA Mindset Matters. I'm Mercedes Dodge, and we're excited to introduce you to our mini mindset editions. With Jessica Spissinger and I, we've created these short episodes for PAs, PA students, and all healthcare providers who want a moment to pause, reset, and reconnect with purpose. In each episode, we will explore reflections, practical insights, and a mindset shift you can apply right away in your training and in practice and in life. Because how we think shapes how we show up for our patients, our colleagues, and ourselves. So let's get started. All right. So welcome back to the Mini Mindset series. In our lifestyle psychiatry episode, I talked a little bit about exercise. And so Jessica and I wanted to dive a little deeper on that pillar. Today, we're going to go more of a biological and clinical lens. So I'm really excited to talk about it. So let's jump in. So my first slide is really about when we say exercise in medicine, we're not really speaking metaphorically. What we're trying to talk about is, from a psychiatric standpoint, exercise directly influences several parts. So specifically, it impacts neuroplasticity. It helps dopamine signaling. It helps the inflammatory pathways, which you talk a lot about inflammatory diseases and chronic diseases. So if this were a medication, we would be prescribing it all the time.
I always say that too. If only we had meds that worked.
This well, right? So it
Mhm.
is such an important treatment, and we have to think of it as a prescriptive tool. And that's what I wanted to dive a
Yeah,
little bit deeper about.
absolutely.
So this slide really just goes over the evidence. I really like statistics. So this is the Hedges G, okay? So it shows the effect size. So it tries to compare all types of exercise regimens. So we're looking at walking, jogging, yoga, strength training compared to an SSRI. So what the takeaway,
Again, I wish I had meds that worked as well as walking and jogging.
right, exercise has a moderate to large effect size in depression treatment. So then there was another interesting study called the Duke Smile study. What they were looking at is, what is the 6-month follow-up? And so what they noticed is that relapse rates was 8% in the exercise group. So that's good. And then 38% in the medication only group. So again, this is not an anti-medication. We as clinicians can really look at exercise as a treatment for a lot of chronic conditions, both psychiatric and physical. And honestly, I love exercise because it builds resilience. I'm really big on encouraging teenagers and individuals to do because it helps us learn to bounce back. Do you have any other takes, exercise with your patients?
Well, I kind of think about the motivational interviewing elements because sometimes I get so excited. I'm like, but just look at this. I want them to take that in, but not feel shamed that they're not able to take the steps to get started.
And one of the things that I see a lot is that I'm more excited about it than maybe many of my patients. Hopefully, they take that energy and it's more of them seeing me as I've learned how it's helped me grow as a person. But again, motivational interviews can be part of your patient therapeutic alliance because not everyone is gun ho. But I think the biggest question is, are we as clinicians looking at exercise as one of the treatment plans, modalities when we talk about depression? And I don't think we do enough. So we need to pay attention as clinicians more on how this not only helps manage depression, but also has really good relapse protection.
The question I would have is that it looks like the study was done with each intervention being done in isolation,
Yeah.
right? So then I wonder about the additive effects.
I think that's caveat with all types of research
Yeah.
studies. We aren't in vacuums, right? We're not being treated by just one monotherapy. In reality,
Yeah.
we're on several. So you're completely right. The next slide, it's dive a little bit deeper on the intricacies in the body. So
Mhm.
the skeletal muscle, when it contracts, it actually releases myokines. These myokines cross the blood-brain barrier and stimulate BDNF, brain-derived neurotrophic factor, which is researched a lot. So a lot of things about the BDNF is that it supports hippocampal growth and neuron survival. But what's the purpose of all this BDNF? What they're noticing is when we have depression, they're actually reduced, the BDNF. And so what we want to do is increase those levels. Exercise really helps that regulation as well as it helps with neurogenesis. It helps with synaptic plasticity. We talk a lot about neuroplasticity, about how to bounce back, but in our physiological brain. So What I wanted to focus on the slide was that in depression, BDNF levels are reduced. What we know with antidepressants over time, when we're taking them, it does increase BDNF over weeks. But when we do aerobic exercise, actually increases BDNF pretty robustly and pretty directly. So not much side effects, right? If we're just
Mhm.
starting to do aerobic exercise, little increments will do that upregulation. So this is where we just literally exercise helps the brain to grow. We just don't know it.
Don't think there's that many things that make our brains grow once we've reached adulthood. So I always think that's a nice hook to hang.
Oh,
So,
yeah. No, this one is about depression and the dose response relationship. So, higher intensity aerobic exercise like jogging tends to produce larger effect sizes. But here's the nuances, though walking still works and yoga still works. Strength training definitely works, but this is a dose response curve. And it's showing that if you're going from a sedentary lifestyle to just modest activity, you get huge benefits, significant benefits. So it's never too late to start. So we want small goals, smart goals that we feel successful, and then we can add more layers to it. That's kind of my approach. So exercise isn't actually limited to depression, and we're going to go over that in the next slide. Okay, so I wanted to expand just a little bit on anxiety, ADHD, and schizophrenia. Anxiety exercise reduces the sympathetic overdrive. It improves autonomic regulation. In ADHD, it increases the prefrontal cortex, which really helps with the activation of dopamine and norepinephrine, and that helps our executive functioning. So in schizophrenia, what exercise does is actually improves those negative symptoms. So we're talking about that apathy, and then also it helps with cognitive function. Again, it goes back to how exercise help with anti-inflammatory mechanisms as well as the neuroplasticity. So it helps in a lot of the diagnoses that we see in psychiatry. So my next slide, I think, is what I want because I love practical information. We just don't say, oh, exercise. What you want to do
mhm.
is prescriptive
Mm.
way. So a good way to look at it is exercise F.I.T.T plan. So F is for frequency. So just find a goal. I would say
Mhm.
2 or 3 days a week. Intensity, you want to do a little bit of moderate work. So the best thing people say is the talk test. So you want to be able to still talk, but you wouldn't
Mhm.
be able to sing. Not enough for you to use all that lung capacity. So time would be figuring out a time. Ideally, I'd say start at 30 minutes and then aim for these ranges mentioned here. And this is the part that I really think is exciting with motivational interviewing is you get to know what people's preferences are and what accents they have, right? If you're seeing an adult, sometimes talking about what they did when they were in middle school or high school, what were they active with? And so again, you just listen to the patient, figure out their preference. I think the other thing, not every patient's the same. So just have that in mind.
I really love this because I feel like it operationalizes getting started really well. I could see this being really to make it more concrete for the patient.
So you're talking to the patient in a way that it's very concrete instead of just doing, are you working out or doing 3 times a week, 30 minutes? Like you want to actually get the patient involved in creating their fit plan. So the next slide is when should we pause? Because we're practicing in psychiatry and mental health, I do think it is important to have some red flags. So this is just a quick review. Underlying eating disorders that we have to make
Mm.
sure we're listening to. Over exercise can be a compulsive behavior that can cause rapid weight loss or stress fractures. Sometimes just having that in mind, exercise being used as a purge compensatory mechanism. The psychological part is we want to catch ourselves how we are talking about exercise and even weight with our patient because there is a lot of shame that one may feel when these topics are brought up. So acknowledging that some patients have intense guilt or anxiety, and obviously they're coming to see you for their mental health. So be clear that this is a safe environment and talk about safe exercise and that everyone's at their own stage. And then just making sure that you assess medical status and clearance. Obviously, if someone has COPD, you have to think about exercise much differently than someone without. So meeting the patient where they are. I think that with motivational interviewing, notice that patients are not at the change part. And so you'll hear them saying things, I want to, but I'm too tired, or I don't have time, or I hate the gym. So it's our job not to correct them. Our job is to refrain. Instead of saying you should exercise, it's like, what is possible? Is there
Mhm.
any movement in your life possible at this time? And start from there, just creating momentum, creating movement. I sometimes tell patients, I don't like the word exercise. It can feel overwhelming. I prefer the word movement. And so I think at the end is finding your way to use your language and also check yourself with your implicit biases when you're approaching these topics. So here's a practical framework. So we talk about action planning. What is one small step you can move towards in this upcoming week? Then there's a scaling question. Let's say 1 out of 10, how confident are you going to do X, Y, and Z? We can use that here. And
Mhm.
so going back to the open-end questions, I think will be really helpful to figure out what are the barriers and say, how would you feel or how would you do? Or how does that make you feel type of question. Like really, the more that we connect how our body feels and what we want to do, the more we realize that we want to change.
Absolutely.
This is just a quick review of how do you integrate the exercise. We've already talked about how to talk about it. It is a very common topic. So just take a minute to start understanding what is their current physical activity. Then the next step is to kind of advise. Again, not telling them that they should do, but see if they're curious to talk about the neuroscience that we reviewed today. Because the more that we can see the connections on our action behaviors and how it's affecting our body, the more we might be motivated to make some changes. So just be there as a guide. The last 2 minutes talks about just the script, the FIIT that we talked about, just so that you can have some scripted goals that you can follow up at the next visit.
I love your pearl to document the activity. Vital
Mhm.
sign. That's great.
Just like you would go into your own medical provider's office, and when they remember your nickname or they remember your dog, those little moments really play a factor that they feel heard. So I would do the same thing when we're talking about goal settings and exercise. In summary, really just talking about movement. Exercise is very powerful, beneficial, has great research behind it. We learned a little bit about the biological background of the BDNF. Now you know a little bit more about why they're talking about it a lot in the news. Then we talked about FITT on trying to be more prescriptive on our exercise regimen. And then that lens of watching out for any red flags, documentation. So at the end, it's about having a holistic lens when we're providing care to our patient. Add-ons, Jessica?
I think this is such a nicely put together comprehensive picture on really incorporating exercise into clinical practice because it's one of those things that can just be kind of vague without operationalizing it. I think this will give a lot of people tools to be able to insert these techniques into their conversations and hopefully help patients along the way,
Yeah.
perhaps as well as ourselves, right? It's always the parallel process. And I'm like, oh, yeah, this is good.
Well, thanks for joining us and watch for our next episode when we do deep dives on topics. Thanks for being here with us at Mini Mindset Series. Our hope with this is simple, that one small insight today sparks a different question, a different conversation, maybe even a different outcome for one patient. Because small mindset shifts ripple into clinic, into leadership, into life. Until next time, take care of your patients and take care of the clinician inside of you too.